this is a kind of a classic example of a patient that's got very fair skin, very dark hair, and we have to be very conscious of making sure that the density is proper. So you can see where he needs all the hair, and that's where we transplanted him. And also, once it's grown out, you've got that nice soft leading edge, but the rest of it is super dense. So you can't really afford to have a patient that's got this skin color have a transplant where everything looks just thin. So you've got to plan that out. You've got to plan how many grafts you're going to do in the front, in the very leading edge, and how many grafts you're going to do behind that. That's his 12-month follow-up. So I think he's very pleased, and he did very well.